Depression is a continuum, from feeling down for a few days after a bad experience to extreme sadness where activities no longer give joy. One has difficulty functioning and might have suicidal thoughts. Biological treatments, such as antidepressants and transcranial magnetic stimulation, can work well for some, depending on the level of depression. But the intent of this video is to focus on psychological treatments, which can avoid some of the side effects and controversies surrounding biological therapies, but still provide long-lasting relief. They can also be used in conjunction with biological treatments. Here are the treatments covered in this video. The approaches can be quite different, and effectiveness for a specific person can depend on the type of depression as well as its possible causes. Let me explain each treatment one by one. Cognitive therapy treats feelings of worthlessness or guilt by challenging negative thinking. The therapist first directs the client to fill out a questionnaire detailing the depressive symptoms they're feeling, and then have them self-monitor negative thoughts throughout the day. Here, the therapist directs Allison to notice and change her negative thinking to positive. He challenges whether her negative thoughts are realistic or cognitive distortions of reality. Here are some common cognitive distortions. Overgeneralization, assuming all future events from one event. Selective attention, only noticing the negative. Catastrophizing, expecting the worst. Mind reading, jumping to conclusions based on assumptions about what others are thinking. Minimizing the positive. Instead of your own effort, you attribute positive events to other factors. Emotional reasoning, confusing your feelings with reality. Personalization, taking everything personally, blaming yourself for things that were not your fault. The shoulds, setting too high standards for yourself and others. All or nothing, inability to see the grays. By identifying how she uses these distortions and by examining the evidence, Allison can produce realistic appraisals and avoid the depression that comes from distorted thinking. Computer programs have been found to be as effective with this as face-to-face therapy. Mindfulness helps keep focus on the present and break the cycle of negative thinking by distancing oneself from intervening negative thoughts. Be in the present, not in the past. Observe what's going on right now around you. Notice the colors, the objects. Just observe. Do not think about them, and do not try to understand them. Just experience them. Close your eyes and observe your own thoughts, whatever they are. Do not analyze them. Do not judge them or react to them. Just become aware of them and the changes that occur. Breathe very slowly and deeply. Slow it down more and notice the changes in your body. If your mind wanders, let it, but bring it back to observing your breathing. Count your breaths. Notice the muscle movements in your body. Do this for maybe 10 minutes. If you feel emotions as you do this, become aware of the physical changes with sadness or confusion and the thoughts attached to them. Notice the change in the physical feelings as your mind passes on to other observations. Realize that these thoughts are not facts and observe them and the feeling without judging them, and let them pass to something else. Accept them, but distance yourself from them. They are only thoughts, not reality. Mindfulness may also use additional meditation practices. Practicing these techniques 10 times a day has been shown to help handle depressive thoughts and emotion without triggering fear. Research has shown it can change the structure of the brain and can be effective as other forms of therapy for depression. Experiments were performed in which dogs could not escape shock. The dogs soon exhibited depressive symptoms like whimpering and remaining still. They simply took the shock, even when they could later escape. They learned that their behavior does not affect change. Not allowing one to have control over the situation can affect mood. One gives up. Counter helplessness, hopelessness, trouble making decisions, isolation. You know yourself that if you feel weighted down by a large, seemingly impossible project, just by doing a little bit, your attitude changes to the positive, and it all seems doable and mood picks up. Behavioral activation uses principles of operant conditioning to replace negative behaviors, such as sleeping all day, with positive ones, such as increased socialization, to lift one out of depression. First, one lists behavioral goals, such as participating in activities that produce enjoyment, like learning guitar, or activities that increase socialization and decrease isolation, or activities that increase personal care, such as getting new clothes or attention to one's health. All these can increase self-esteem and decrease depression. Identify activities from easy to hard targets, a plan for progress, including strategies to deal with possible problems during the process. Devise a reward system using what you like to do, or use support from friends, family, or a therapist. Behavioral activation can also aim to teach others around you not to reinforce depressive behavior with sympathy. Other therapies and activities seem to reduce depression. Studies have shown that aerobic exercise can be as effective as medication in reducing depression. Some see increased depression in the winter months, when daily light levels decrease. There is a biological basis for seasonal depression relating to a melatonin-serotonin balance in the brain, affected by daily light levels. Using light boxes while reading or computing during specific times of the day has been shown to provide relief. Of course, staying inside with a lack of activities during the winter can also increase depression, and behavioral activation could be used to change this. Other treatments see depression as part of broader interpersonal deficits. That depression involves current relationships. Interpersonal therapy trains people skills and communication for better social interaction, and trains one to decrease depressive body language, such as sad facial expression, lack of eye contact, or slow speech that might hinder good relationships. It also helps those cope with depression caused by grief and loss, as in divorce, death of a spouse, or the onset of retirement. Marital therapy can help resolve conflict and issues that cause depression, and reduce criticism of a partner or role disputes, as well as encouraging more together activities that both can enjoy together. Sometimes, family therapy advises on child rearing practices for depressed children or teenagers, such as being too critical or over-involved. Or adds support training for children of elderly parents, both for their demanding caregiver roles and for their parents who have become depressed with the aging process. These are not mutually exclusive approaches, but can be used together to increase effectiveness in reducing depression. Use depends on the level and type of depression, as well as the particular characteristics of the client. Here are some questions for the comments section below. Also visit my website, intopsych.com, for more resources. And be sure to subscribe to this channel.